Now, when you look at a hand as a hand surgeon, it's interesting. Hi, Ram.
Hi,
Good to see you.
how are you, Randy?
Good, very good. Thank you.
Good
Very
to
good.
see you in the morning.
Yeah.
Your night, of course.
So, so when you look at somebody's hand, once you get into hand surgery, and I've been doing this for 25, 30 years now, you just look at a hand and you can tell what's going on, right? You can see muscle wasting. You can see there's a burn there from his cigarette because the fingers are yellow. So, this person likely has severe carpal tunnel syndrome. So the hand talks. And with an organic disorder, we have a pattern. So if they have cubital tunnel syndrome, they'll have numbness on the small finger, they'll have tenderness at the elbow. So they will have given pattern of symptoms, they'll have recognizable signs, and you and I can say, I can make you better. I can do an operation, make you better. So we call those organic disorders. If you look at this young lady, you can tell she's been traumatized, cigarette burns on the back of her hand, multiple self harm, lacerations in the forearm. It's an unfortunate situation of depression, but she is not trying to hide it. She's got a psychiatric problem, and you know that she needs help. So she is not trying to hide it. The group of disorders I'm talking about are patients who create an illness, but they hide the fact that they are creating the illness. So they are trying to deceive the medical community, the doctors and the nurses. So as a group, we had organic disorders like carpal tunnel syndrome, wrist arthritis, non-organic conditions. There are problems that start without a specific pathology. So without anything, like there's nothing really wrong. There is no pathology going on, but it's related to a psychological issue. And here is, we'll take two cases and then I'll talk about the different conditions and we'll come back to these two cases to try to understand. So here's a lady and she came to my clinic. She's 34 and 2 months ago, she had cubital tunnel surgery. And after having cubital tunnel surgery, at that time her hand was normal. She's now come saying, my hand is stuck. I can't move my wrist. I can't move my fingers and my whole hand is numb and stiff. And you're thinking to yourself, this doesn't make sense. It doesn't fit in a neurological pattern. She's had ulnar nerve surgery from a surgeon who knows what he's doing. He couldn't have done anything wrong. So what's going on? Then you look at the surgeon's note, okay? Now this is the note from the surgeon, and I've highlighted the facts here. So patient has subjective numbness. That means she's not really numb. She just says, I think I'm numb in that area. The physical signs were negative. Nerve conduction studies were normal. And he said here, I was not optimistic about the chance of success, right? So surgeon feels in his gut that this patient doesn't have a real problem. In spite of that, he operated because the patient insisted. Now that is where a lot of young surgeons will get caught out. The patient says, I want you to do an operation. I want to get better. And in your mind, you're thinking, nothing fits in. Something is wrong.
Okay.
Don't do the operation. The moment he did the operation, this is what happened to the patient. She became worse. Look at this other situation. This is a nurse. Now, the reason I stress here
Terrible.
nurse is a lot of these conditions, a lot of these factitious disorders are present in either medical personnel or spouses of medical personnel. So a lot of these people have some knowledge of medicine, so they can manipulate the facts, they can create false symptoms and signs. So this nurse came to me saying, Dr. Bindra, I've got a wound here. This has been present for 3 weeks. I accidentally cut myself with a knife. I'm cleaning it myself. All I want you to do is give me a prescription of antibiotics because she needed a script for it, but I'll be managing myself. I don't need any care. It's going to get better. And when you look at this wound, you got flexor sheath exposed, you got granulation. It doesn't look normal. So this patient, in converse to the previous one, actually has a problem, but she seems very nonchalant about it. She's not worried about it. And so you're wondering, this is not right. Anybody else with a wound with flexor tendon sheath exposed would be extremely anxious and worried about it. Now you would say, why have we got this international hand surgeon giving me a lecture on psychiatry? And I'm not a psychiatrist by any means. The challenge is most of these problems are much more common than you think. And whenever I give this lecture anywhere in the world, most surgeons immediately come to mind and say, you know what? I've had two people like this in the last 6 months. Now it kind of makes sense as to what's going on. So it's a much more common problem. The mistake is if you do surgery on them, they are then going to walk around defaming you in all of the suburbs of Mumbai. They'll go to all these other suburbs, meet all your other colleagues and say, look at what this doctor has done to me. They've made my hand worse by operating on me, although they are the ones who were begging you to do the operation in the first place. So that's where you have to be careful with these patients. Now, if you were to try to classify non-organic illnesses, there are two common times we see. Somatoform, and this is like, some people get a rash when they're under stress. Some people get irritable bowel syndrome, and some people get a conversion disorder or hysteria. They fall down and say, oh, my leg is paralyzed. I can't walk. My leg is numb. We are familiar with those conditions. And of course, some people have aches and pains all over, and we call those fibromyalgia. And some people, of course, everybody has a little bit of hypochondriasis. And right now, I think we should be using this term rather than cancer. Everybody's worried they've got this going on. Now, the unintentional disorders, those were all unintentional. So all those conditions were unintentional. The patient doesn't try to create them. They think they have a problem. Now, factitious disorders are intentionally produced. So patient creates the problem on purpose. They will come to you with physical signs on purpose. They will read the book to know what symptoms and signs to make. So they will come to trick you. So it's an illness that is deliberately produced and it's falsified for the sole purpose of being sick. They want to be a patient. They don't ever want to get better. They always want to be a patient. When you finish the treatment, they'll be angry with you. They'll make a fight with you. They'll go to the next guy and ask for another operation. So I had a patient who had 18 operations on the distal ulna, and he was angry because I refused him operation number 19. Now, if there is an external incentive, that means they're doing this to get some money or get time off work, etc. They're a malingerer. So these patients are not malingering. They're not looking for any gain other than your sympathy. How common is it? Well, some people estimate in medical clinics up to 10%, especially when you look at a condition such as pyrexia of unknown origin. Almost 10% of those patients are doing things to themselves to raise the body temperature. So they're just lying and they're tricking the doctors. How much will it cost the hospital? Now, in 1991, Grunert, and he's a psychologist in one of the hand surgery units in America. And if you look at this is 20 years ago. At that time, the cost was $52,000. And why does it cost so much? Because this patient, comes to you with a sign. You're like, this doesn't fit into it. I'm going to have to get nerve conduction. That will be normal. You'll get ultrasound. You'll get MRI. You'll get CT scan. You'll get X-rays. You'll get second opinion, third opinion, neurology opinion. So they waste a lot of money. They affect their own health because they're spending a lot of time in the hospital. They affect the health of the treating staff because every time that patient comes to your clinic, you're like, not this person again. I'm fed up with them. Why do they keep coming back? They keep coming back because they want you to do an operation. They want you to get involved with their care, which you are trying to avoid. They affect the health of genuine patients because they're sitting in a waiting room and they're saying to the patients, this doctor is no good. I've been coming here for 1 year. He can't figure out what's wrong with me. So your genuine patients start to get affected. And the problem is sometimes these patients they'll turn on you. They'll become your foe or your enemy, and they'll decide to create a litigation. So they are just a problem case. And the best thing is not to get very involved in their treatment. I'm going to now show you some patterns of factitious disorder that you will see as a hand surgeon or even as an orthopedic surgeon. And for example, one of the common ones in the knee clinic would be a locked meniscus, where the patient comes in with a locked meniscus, but they are always normal, and the knee gets straight after under anesthesia or after a few days. So we're going to go through some common conditions. The most common is Munchausen syndrome. Now, of all the conditions that you will see with factitious disorder, most of them are common in female. Munchausen is more common in men. Munchausen patients will create a problem for themselves. So they will create a wound They will create a problem. They will bang their hand and create a problem. They will physically create a problem and come to you. So Munchausen patient will injure themselves. Named after Baron von Munchausen, he was a German soldier who would go around telling false, untrue stories and get a free drink from everybody. So this is one of the common causes of factitious disorder, more common in men, severe. They don't get better. When they finish with Mumbai orthopedic, when they finish seeing all the orthopedic surgeons in the suburbs of Mumbai, they'll go to the central Mumbai and see patients. When they finish there, they'll start seeing patients in Thane. Then they'll go to Pune, but they'll keep finding doctors out of the region so that nobody knows their past history. They will do peregrination, which means that they will talk about something that's irrelevant. So when you say, how long has your wrist been hurting? Well, you know what? And they will do pseudologia fantastica. So they'll say, you know what? I'm a friend of Narendra Modi. He and I used to sell chai together, chaiwalas. We were chaiwalas together in Delhi. And then when he became prime minister, I left and I came to Mumbai. But what about your wrist pain? Well, let me tell you, when I was selling chai, one day, the chai was very hot and I dropped, but they will not come to the story. They will keep telling you some tall stories about how they know the chief minister, prime minister, your boss, the boss who trained you, because they would have read about you and they would know where you're from. They know everything. And they come to you saying, all I want you to do is see this ganglion. I've got this ganglion. I want you to take it out. And you'll be like, does it hurt? Yeah, it hurts a lot. Does it affect? Absolutely. It stops me working. And they're begging for surgery. So you want to be very careful with these patients. Another group of patient is now the shaft syndrome patient, okay? They are scared of creating a problem. So they will come to you and they will say, can you cut me over here? Can you take this lump out for me? Take out my ganglion. Or they will say, my hand is numb. Can you do my carpal tunnel surgery? I've got carpal tunnel syndrome. And they will fake all these symptoms. They will come to you very sad. Nobody helps me. I went to see Dr. Prabhu. He said, no, you don't have a problem, but I think I have a real problem. He won't help me, but I know, you have just returned, Dr. Muta, you've just returned from England. So you're very smart. So you will know exactly, you will believe me, and you will exactly know that I really have carpal tunnel syndrome, and I want you to do my operation. When you finish the operation, now they're hostile. What have you done to me? You've destroyed my hand. Now my hand doesn't work. When I came to you, I could move my fingers. Now my hand is stuck like this. Why have you done it? And they're frustrating. They will not go away, and they're tenacious. They'll keep coming back to your clinic to ask for surgery. But they're not Munchausen, so they will never cut or hurt themselves. They will have the doctors do it for them. And they will, if you deny them treatment, they'll be very aggressive before they leave your clinic. So they're very manipulative. They'll come to you and say, I've been told you're the best. Nobody else knows what they're doing. You're my last chance. So if you start your practice and you're new, right? And somebody comes to you and says, I've heard all about you. You're the best doctor in Mumbai and you're the only one who can help me. Be suspicious. Don't start saying, oh, absolutely, I am the best. I'm going to do your operation. Don't get drawn into that scenario. When your operation is over, this is what they're going to do to you. They're going to be angry and they're going to complain about you to everybody and to all your patients around you. So here's that same scenario that we talked about in the beginning. So this lady had numbness in the little finger, told her doctor, I insist you do an operation, even though the doctor put in the notes, I don't think she needs an operation. I don't think she will get better. Her nerve conductions are normal. Well, then don't do the operation. Unfortunately, he did the operation. Now she's got this problem, which is completely factitious. And she's come to me saying, I need you to do a revision surgery on me and make my hand better. Clearly, she needs psychological help, not surgical help. Now, some people will come to you with a swollen hand or wrist. This will be unilateral. And these patients are interesting because they don't have pain. The hand is swollen. And you say, can you move your hand? Yeah, I can do everything. But look at the swelling, doctor. The swelling is terrible. It's not going away. And when you take off their shirt and go all the way up to their shoulder, often you can see a cutoff where the swelling ends. And that's because they put a tourniquet on at night, make the hand swell up, and in the morning they come and show you. Now, obviously, you will have to do tests to make sure they don't have a venous thrombosis. So you can get a venogram or subclavian vessels ultrasound. Okay. Now, in some people, if you're not sure whether they have some kind of a lymphatic obstruction or lymphedema or true lymphedema, you will have to do a lymphangiogram, and that is the one that will show you what's going on. You have to be very careful with anyone with a swollen arm and look for a tourniquet or something that creates that problem. So here is a man who came to see me, ex-policeman, and never gone back to work for 15 years because he had a DRUJ injury and had his DRUJ TFC repair. Ever since then, his hand is swollen. And he's like, my hand is so swollen, I can't do anything. And I'm like, do you wear a splint on your hand? And he takes out a splint from his bag and says, yeah, this is my splint. And so this fella wears the splint all night, makes his hand go tight, and in the morning he complains to everybody that his hand is so swollen and he cannot work. So clearly, this is not a normal person. He's got a psychological disorder that needs to be addressed. This was a paper published by Dr. Smith in JBJS, and here you can see that this is a lymphangiogram, and in a lymphangiogram you can tell where the tourniquet has been applied because that is the area where you get the broken window pane. So this is a normal lymphangiogram. This is like all broken lymphatics because they've been applying compression with the tourniquet right at this level. Here is an example from a dermatology journal where this girl has swelling of a right hand, correct? And what the doctors found was a little puncture mark here, and she's left-handed. Remember, this will be on their non-dominant hand. So she was taking a syringe on the hand and injecting it. So when you see someone with a swollen hand, get an x-ray. When they did an x-ray on this girl, they found gas or air shadow in the soft tissues of the hand, and she was self-injecting and giving herself hand swelling. Another condition you'll see in patients, and I see this very often in prison patients. So if you're in Mumbai, and if you see patients from Arthur Road Jail, I know in JJ we see them, they will hit their hand on the cell of the jail, on the walls, and give themselves a thickening and swelling, so they get a day out to come to JJ hospital or wherever, and they come to the hospital and they sit in the clinic and they scare all the other old ladies sitting over there. And Secretan, who first wrote this paper in 1901, found this in coal workers. And the coal workers who wanted to get out of work would bang their hands in the coal mines and say, my hand is swollen and I can't work. Now, when you look at these patients, they have hemosiderin deposition in the skin, and that's because they've been hitting it, they're getting little bleeds. So the skin color is different besides the swelling. And the swelling is not like a soft tissue swelling. You can actually feel a mass around the extensor tendons. And of course, the best way to diagnose it is with MRI or with an ultrasound. Now, here is someone with Secretan syndrome. Now, this is from one of my mentors, Professor Burke. So Professor Burke, this is one of his patients and his slide. And he shows how this patient had this thing, and they thought it was like a rheumatoid. And when they operated on it, all they got was nondescript scar tissue. So it's not soft synovial tissue. It's a thick white, it almost looks like Dupuytren's tissue because it's just type 3 collagen, just scar tissue from repeatedly banging the hand on the wall. A common condition you will see, again, is patients with non-healing ulcers. Sometimes it'll start, they'll say, I don't know how it started, or a small injury, or a mosquito bite, or a spider bite. And sometimes they will have had an operation, like a ganglion or a carpal tunnel. So something a surgeon did, and they will pretend to be a surgical infection. They're otherwise quite healthy, but they will tell you the wound has not been getting better for weeks and months, which does not make sense. Now they say, we want the wound to get better, but you're wondering why it's not getting better in spite of all the treatment you're doing. Now, Dennis Phillips wrote a nice, clever paper on how you can do this tetracycline fluorescein testing. The trick with this is you put some tetracycline on the wound, right? You tell the patient this is magic cream. If it is on your hand for 24 hours, by tomorrow morning, your wound is going to be healed. So you have to come to my clinic tomorrow morning, but don't touch the dressing because the magic will be gone. Now, the patient is going to go home. They're going to take out all that, wipe it off, and rewrap it very carefully so it looks undisturbed. And when they come to you the next day, the dressing will be non-touched. You'll say, did you touch it? No, I didn't. Okay. And then when you look at their other hand and you do fluorescence like a UV light, you'll see they've got all the fluorescence. On the other hand, that means they've opened the dressing and they've touched the dressing and rewrapped it up. So you can pick them up as they are interfering with the wound healing. Here is a patient, again, this is a patient of Professor Burke. Patient kept coming back to clinic with a small wound. And we are doing little biopsies and all kinds of things to figure out, is it a squamous cell carcinoma? What is it? Finally, someone said, let's do an X-ray. And the patient has been shoving in paper clips and all kinds of wires into his hand. And even though we took it out, he came back repeatedly with more and more stuff in there. So you can't really help these people. They have a serious psychological problem. This was that nurse who came to me. So I said to her, to make your wound heal, I'm going to have to put you into a cast. Now, this is the thing where they will definitely resist it. They will come to you saying, the cast is tight, I'm claustrophobic. They'll keep fighting you to try to get the wound to heal. And you have to kind of confront them in a good way and say, look, I know this is a problem for you. I know there's some stress going on in your life. I'm going to get you some psychological help, but I have to put you in a cast. Otherwise, you can go and see another doctor. The only way I can treat you is in a cast. So in the end, we put this Integra, which is an artificial dermal matrix. We did not graft it. You don't want to do a complex operation. If you do a skin graft, they will then, if you take a skin graft from here or here, you've given them a new wound. So now they have two wounds that will not heal. So try to avoid creating an extra surgical wound. So we put the Integra on, put her in a cast, and she was not allowed to disturb the cast. We would take out the cast in the clinic. This is by 6 weeks, and this is eventually by about 3 months, this had fully healed, but we always kept her, this part of hand wrapped up in a cast so she couldn't interfere with it. The last type of disorder that you will see with these patients is clenched fist syndrome. And these patients come to you with their hands clenched, but they have these fingers open. So they can do everything, but when you ask them to open these fingers, they say, I can't. When you go to open it, they have paradoxical stiffness. That means while you're talking to them and discussing, they'll relax. And the moment they know that you open it, they'll quickly go right back. When you give them anesthesia, they'll be open. The moment they wake up, it goes back in flexion. So the key with these patients is if you do give them an anesthetic, give them a regional block. So they can't squeeze it in anymore voluntarily. Open it, make sure they're awake so they can see that it's open. Because if you do under GA, when they wake up, they'll pull it down again. So you will not be able to let them know that you're aware this is a factitious disorder. And here is a similar lady. Of course, in the Western world, Dupuytren's is quite common. So we have to make sure they don't have Dupuytren's disease. Sometimes you will see elderly patients with dementia with this thing, and that's just a primitive kind of withdrawal reflex. That is not the clenched fist syndrome, but this is a common condition. It's funny, when I sent this patient to the psychiatrist, he said to me, this is a hand surgery problem. And then I had to send him the reference article called the clenched fist syndrome and said, no, this is a psychiatric problem and you need to be treating this. So it's funny, even psychiatrists are not aware. Now, here is a patient of mine from 1 month ago. He's had an injury to the ring finger, right? So it's a little bruised. But you look at his hand, he's got dystonic posturing. I'm putting his hand down and he pulls it. You ask him to make a fist and he's doing this funny motion where, see this? He's got spasms, his hand is trembling. We did plain x-rays, they're normal. We did MRI scan, normal. We did ultrasound testing to see if the pulley was ruptured. Nothing wrong with him. He's 1 month from surgery. You can see his hand here. He's not washing it. It's all dirty. He's completely gone into a psychological problem, and he's developed dystonic posturing, a type of clenched fist syndrome. And so now he's not gone back to work. It's been 6 months now, and he's under the care of a psychiatrist. Something has happened. He's had a work injury. He's had stress at home. He's 17. His parents have gone through divorce. He left his home, living with his aunt. There's some other psychological problem going on. He gets a small injury at his job, and before you know it, he's become a problem of a factitious disorder where he's creating problems and going to different hand specialists to try to get better. What he really needs is a psychiatrist. So what are the indicators that this is a factitious disorder? When the signs and symptoms and posture don't make sense, there is something wrong. If there is a wound that should have healed by now, there's something wrong. When they keep coming to different doctors, when they've been to Dr. Prabhu and now they're coming to see Dr. Pankaj or they're going to see Dr. Muni, and when Dr. Muni says, I'm going to call Dr. Prabhu and get your notes. No, no, don't need to get his notes because I didn't get on well with him. Don't get his notes, because the fact is, when you get notes from Dr. Prabhu, you'll see that Dr. Prabhu has said this patient should not have an operation. They're manipulating their signs. They don't want you to get medical records from somewhere else. When you tell them, I want to do your nerve conduction study, and the nerve conduction study says their nerve conduction is normal, you know what they're going to say? They're going to say the nerve conduction machine was wrong. The doctor didn't do it properly. He was distracted. He was talking to his wife during on the phone. He wasn't doing the test properly. I think it's all wrong. So these patients they will dispute every lab test and every result that you will do. And when you tell them, I think this is a psychological problem, they will often turn angry on you and say, what are you saying? I'm a crazy? You're saying something wrong with me? Something wrong with you? You can't diagnose what? And they will walk out of your clinic in a disruptive manner. But the key is that you don't want to operate on them, because these people will be very, very willing to have an operation. How do we treat these patients? Obviously, they need our empathy, right? You can't just dismiss them. So we have to say, look, I know you have a problem. I'm going to make your wound better. However, I need to do this. I need to put a block on your arm, and I need to see if your fingers can be straightened. If they've got an ulcer, you say, I have to put this in a cast, otherwise your ulcer cannot get better. It's a very complicated type of ulcer. But I need you to see my friend here. He's a psychologist. Sometimes patients don't mind seeing a psychologist. They don't want to see a psychiatrist. I want you to see the psychologist. I think you've got some stress, right? What's your situation? And usually they will gradually open out to you, and then you'll be able to send them to see a psychologist. And they need behavioral therapy, they need psychotherapy. Generally, the prognosis with Munchausen syndrome is poor. With some of these other conditions like clenched fist syndrome, with psychotherapy, and then they can get better. But generally, don't operate. Get splints, get casts, and do simple things. Don't make a surgery. Don't give them a scar, or all they will do is make matters worse for you. Thank you.